Welcome to the United States of America, the land of freedom, of superheroes, and of a healthcare system that can turn a common cold into a massive mortgage debt. We are the richest nation on the planet, yet this is where people have to start online fundraising campaigns. This is not an accident. This is a business model, finely tuned to maximize suffering and profit. The U.S. accounts for 42% of global healthcare spending. What are we buying with those trillions of dollars? We are buying anxiety, delays, and a round-trip ticket to bankruptcy. In this system, insurance does not exist to make you well. It exists to collect premiums and deny claims. The dark humor. You pay thousands of dollars every month. When you get sick, they send you a 50-page booklet explaining why the service you need is out of network or requires you to wait 6 months for pre-authorization. A hospital bills $500 for a generic ibuprofen pill, not because it's worth $500, but because they need a starting negotiation point with the insurance company. And who pays that horrendous gap? You do. An insulin injection costs $5 to manufacture. In Canada, it sells for $30. In the US, it sells for $300. Who's profiting here? The architects of artificial scarcity. The American healthcare system is excellent at selling systemic delay. Feel a lump? Congratulations. You must wait 4 to 6 weeks for an MRI, then another 2 weeks to see a specialist, and then wait again for surgery approval. While you wait, your illness doesn't stop. It grows, it gets more severe, and naturally, it gets more expensive to treat. This is a wicked brilliance. Delay increases cost and guarantees you return multiple times. You receive sick care, not health care. Now let's step away from the false glow of the West and look towards a place the wealthy world often forgets: Vietnam. A developing nation, yet their healthcare system is a painful lesson for Western arrogance. How can a developing country achieve this extraordinary balance between cost and efficiency? First, the walk-in care policy. They prioritize speed in examination and initial diagnosis. Patients are seen almost immediately. There is no insurance gatekeeper creating obstacles for you. Illness is detected early, meaning treatment is easier and 90% cheaper than in the US. Second, preventive and community health care. They invest in grassroots medicine. Instead of waiting until people get sick to profit, they are buying health for the people, not debt for corporations. Let's take dentistry as the clearest example. Dentistry in America is treated as a luxury item. A simple dental crown can cost $2,000. In Vietnam, with the most advanced technology, you pay $200. The cost is 10 times lower, but the quality of service and materials is frequently better. The reason: no huge teams of lawyers and administrators to handle insurance claims that inflate administrative costs. Also, no monopolistic price manipulation by corporations. Money is reinvested into patient care, not into profit. A knee replacement surgery in the US can cost $50,000. The same surgery in Vietnam costs only $5,000. You are paying $45,000 in administrative care fees and corporate profit. The U.S. healthcare system is not a care system. It is a debt distribution machine. They have all the resources, the finance, the technology, and the most brilliant medical minds. But instead of using them to serve humanity, they use them to serve profit. It is time we ask the tough questions. Why do we accept paying 30 times more for less effective care? Illness is not a personal failure. Being bankrupted by illness is a systemic failure. If a nation in Southeast Asia can do this, there is no reason for superpowers to maintain this life and death profiteering system. The cost of a life should not be the cost of your future. The world is waiting for a revolution. That lesson was written in Hanoi, not on Wall Street.